Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing about ice cream cone sign in ENT. Now there are two such scenarios that we see this in, and both of them are in case of fear. But there is one ice cream sign which is a normal finding that we see, and another one which is a pathology. We'll talk about both of them, and we'll talk about what is it exactly, where do we see it, what is the reason behind it, and maybe some few MCQ questions related to it. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. Let's look at our first one, which is a normal finding. Now, you can see this is what an ice cream cone looks like. Obviously, you know that. And if you look at the first image over here, we can see that this looks like an ice cream cone, right? This is like the scoop, and this is the cone. So what is this? Where do we see this? So as we can see that this is a radiological sign that we see on a normal CT scan of the temporal bone. What is it exactly? This you see that the first thing that you see is the scoop. And the second part that you see, this part is the cone. The scoop over here is the head of the malleus. And the cone part over here is the body of the incus. Both of them together resemble this ice cream cone looking structure, and this is seen in a normal middle ear anatomy. And if I had to ask you which section of the CT scan will you be able to see this on, we will be able to see this on an axial cut of the CT temporal bone. Now, this is basically an axial cut that has been taken through the epitympanum, and the head of the malleus is appearing like this ball-like structure, and the cone is formed by the body of incus. With the tapering conical point that we're seeing over here, this is the typical tapering conical point is formed by the short process, which is pointing towards the adytus ad antrum. And the lateral, we all know the Prusac space or the lateral epitympanic space. This is located laterally to the malleus and incus over here. So this is about this normal ice cream cone sign that we see in a normal temporal bone finding. And as you can tell, the reason why it's called ice cream cone sign is because it exactly looks like one. What is the importance of having this sign? Why do we need to look out for this sign? If we see in any case the loss of appearance of this ice cream cone appearance, it can indicate an incudomalleolar disarticulation. And the best imaging, as we have discussed, is to do a CT temporal bone axial section. And now this brings us to the second question. What is the pathological ice cream cone sign that we see in ENT? And this is seen in case of an MRI rather than a CT scan. Now, so that brings us to the second one. This here, as you can see, this is also a radiological sign. But in this case, we are seeing it in a MRI scan instead of a CT scan. Now, what is the characteristic appearance that we are seeing here? Now, this ice cream cone-like appearance is actually that of an acoustic neuroma, which is also known as vestibular schwannoma, which is a tumor that we see in the ear. And the tumor in the cerebellopontine angle is this portion, the part which is forming the scoop. This portion is forming in the cerebellopontine angle, whereas the cone portion over here, this is forming in the internal auditory canal. So this is basically the tumor extension in the cerebellopontine angle and the internal auditory canal or internal auditory meatus. This ice cream cone sign is a typical feature of acoustic neuroma or vestibular schwannoma. Now, vestibular schwannoma is a tumor which arises from the Schwann cells, as the name suggests, Schwann cells of the vestibular nerve. It is important to remember that. And this tumor grows outwards from the internal auditory canal towards into the cerebellopontine angle. When this happens, it leads to this typical ice cream cone-like configuration over here. So I'll repeat myself over here. The ice cream cone sign over here, the scoop component is the part which is there in the CP angle or the cerebellopontine angle, and the cone part is the part which is there in the internal auditory meatus. Now, just a few MCQs before we end this class is the best investigation in case of acoustic neuroma is to do a MRI with a gadolinium contrast. The most common symptom that we see in these cases is a unilateral sensory neural hearing loss. So one of the differential diagnoses for a unilateral sensory neural hearing loss would be acoustic neuroma. And the nerve involved over here is the vestibular division of the auditory nerve. And another very important viva question is, could you tell me a syndrome which is associated with acoustic neuroma? This syndrome is neurofibromatosis 2. In neurofibromatosis 2, we see bilateral acoustic neuroma. So what you'll end up seeing is a bilateral ice cream cone appearance on an MRI if it has involved the cerebellopontine angle in cases of neurofibromatosis 2. So that's about the two different ice cream cone sign that you see in ENT. If you have any doubts regarding this, please note them down in the comment section and I'll get back to you.